Welcome to today's episode of Aesthetics and Wellness by Dr. Yusra. Today, I had the pleasure of having Kelly Saynor on our podcast. She is the owner of Medica Forte, a company that makes the amazing Perfect Peel. We talked about skin biology and skin health and how this particular peel addresses 3 pillars of skin health, including pigmentation, texture, and secretions. We talked about skin of color, the biology of skin peels, how it can improve skin aging and skin radiance. And we ended with a little tip for the younger generation. Enjoy. Hi, welcome, Kelly. Thank you for joining me on the Aesthetics and Wellness podcast by Dr. Yusra. Today's podcast is all about skin peel, skin rejuvenation, resurfacing, and you are the queen of the queen when it comes to that. So I'm going to do a little bit of an intro about skin peels and a little bit about you. So Kelly is the owner of Medica Forte, who are the makers of the Perfect Peel, a renowned, bespoke, very unique peel because it's a peel for skin of color, which means it's accessible to patients of all colors. And also it's a peel that doesn't require any skin prep. So without further ado, Kelly, will you tell us a little bit more about you?
Of course. Well, thank you for having me.
It's a pleasure.
It's great to finally be here.
I know,
I've
been like talking about it for ages.
Oh my God, I've watched you for a long time as well. So I am completely honoured to be here, really.
Well, listen, whatever you're doing really well because you just told me your age is 43 and I know I've given it away. But my God, you look 23. So we need to hear all about it. I've been doing skin peels in my clinic for years, but we just recently introduced the Perfect Peel. Yeah. So I want to hear your journey and how you started with it, how you brought it into the United Kingdom.
Yeah, sure.
Tell us more.
Okay, so, well, interestingly for me, so I'm adopted. My parents are white. Historically, that meant that I had no other real understanding of friends of mine that were darker skinned. So I did a lot of my own research, was buying things like hydroquinone from an early age online.
Really?
From Black Hair Directory.
Oh my God.
Black Skin and Hair Directories. My dad, bless him, was going to the paper shop buying these magazines for me. They had no idea what I was buying. So I was very aware of my colour from a young age. Yeah. And that gave me I felt like gave me a bit of a head start.
And were you alone? Did you have other siblings?
Yes, so my sister's black. She's 4 years younger than I am.
So she was adopted as well?
She was adopted as well. We were adopted from Jamaica. My dad's Northern Irish. My mum's from Derbyshire.
Oh my goodness.
They lived in Jamaica for years. We were a very big part of the Jamaican culture. Yeah. Realised they couldn't have kids and adopted us. So I just feel really fortunate there anyway. Yeah. But moved into a fairly predominantly white area, which was great for me because it really gave me an understanding of my own skin of colour and my friends. So it's been something that has been a real 360.
See, there's always a why. There's always a why behind the journey. This so makes sense. It's amazing. So how old were you when you were adopted?
So I was about 18 months. They found me in a children's home. Oh. And my sister was adopted from birth.
And are you and your sister?
We're not blood related, no. But we might as well be, now. Yeah. And my mum and I are identical.
Yeah. And were you told you were adopted when you were old enough?
Absolutely. Yeah. Loads of people said, when were you told? And I was like, it was probably kind of obvious, but but look, I got asked that question a lot. What point did you know? Because it could absolutely have been. Yeah. They were very open, very honest. And I just felt really fortunate that it gave me the why, like you say. They wanted to understand. My first foray into skincare was wanting to use white skincare like my friends. And I realised that wasn't actually suiting me. Yeah. So I knew I wanted to be a nurse. Yeah. I was a paediatric nurse. Started my life out in aesthetics at the Harley Medical Group.
Oh, wow.
And back then, peels were just not like they were. The landscape was entirely different. Yeah. And that gave me a real good grounding because when I started at the Harley Medical Group, aesthetics was about
Botox 3 areas.
Botox 3 areas.
You don't get lines.
100%. Yeah. We're just chasing lines. And it made up about maybe 40%. Yeah. And when I left, it was the opposite. So we were doing surgery, non-surgery, so surgical to non-surgical. It was, Botox and fillers were...
So I feel like we've missed an intermediate. I'm caught up in the story now. So you were born in Jamaica. Your parents were in Jamaica. They adopted you in Jamaica and then they moved over to the United Kingdom.
Yes.
And then you found yourself in a very white background.
Yes.
And then quite quickly realized you didn't look the same.
Yep.
And started to try to lighten your skin color.
Absolutely.
With hydroquinone bought from where?
From
Online.
Online.
Oh my goodness.
Got sent
and for
over.
those of you who don't know, that's super dangerous, right? Because it's unregulated.
At 12 and 15 years old.
Yeah, it is actually crazy. You hear a lot about this also in Arabia and the Middle East, where my background is. People until today are buying hydroquinone over the counter, very high
Absolutely.
doses, not understanding the risk. And when we're talking about risk, we're talking about permanent discoloration,
Absolutely.
occlusive, which is highest in Africa and the Middle East.
Yep.
Over here, we don't really see it because hydroquinone is on prescription.
Yeah.
So it's regulated.
Absolutely.
And when we are prescribing it, it must be under the supervision of a medical practitioner. And we're doing it in low doses for
Absolutely.
a specific period of time.
It's still the gold standard.
It's still the gold standard.
It's amazing. But like you say, understanding the flip side of it, understanding the dangers of it, it was available over the counter.
Yeah.
2%.
I mean, I remember when I was young, actually, when I was in the Middle East, I had 3 years in the Middle East. They used to have this tube called, I think it was called Fair and Lovely. Have you heard of it?
Yeah.
And you'd find it in corner shops.
Yes.
And I'd be like, oh, well, I want to be Fair and Lovely, so I'll buy that. You know, I mean, how it's
100%.
insane, right?
Yeah, absolutely.
And also, just like by virtue of that, if I saw that now, I'd be like, Fair and Lovely, excuse me?
100%.
What's wrong with Dark and Lovely, right?
This is it, 100%.
And my daughter is, she's kind of olive skin tone.
Okay.
And dark hair. And she's probably the only one in her class.
Right.
And she's now quite aware of it. So she has come home a few times and said, Mama, why am I not white? Why don't I have light hair?
Yeah.
I want to be beautiful. I want to have light skin.
Yeah.
And it's a really delicate and conversation, but also quite a painful conversation for me to have with her. And I thought,
can appreciate that.
People, you no matter how much you want to shield your children from that, they naturally will become aware of it. And it's up to us to also explain to them how beautiful they are in their own skin.
I remember my son, I've got 2 boys. My eldest is 18. And he said to me, I don't feel like I'm black enough or white enough.
Yeah, it's like this in between.
He's in between. I was like, you're amazing enough.
Yeah, exactly, that's it.
That's it.
You're unique. So when it comes to your background, you started 20 years ago. So at the tender age of 23 in aesthetics.
Yeah.
From a background of nursing.
Yeah.
And I remember what aesthetics was like when I first started. It was definitely Botox-free areas, lip augmentation, nasolabial folds, crack on, love. There was no real, right? Like
we weren't taught that way, were we?
We were not taught that way. And it was very much vanity-driven rather than wellness-driven. I talk about this a lot, that I think we are undergoing a seismic shift where we're moving away from being an industry centered around vanity alone to one centered around wellness, because we understand now that how we look on the inside has a profound and positive impact on how we feel on the inside.
Well, I remember being part of the corporate machine, and I have every love for the Harley Medical Group. Loved them. They gave me the best start in aesthetics, but having that corporate side really made me feel very passionate about the way I didn't want to do it.
Oh my God, same. Yeah.
So, it was important for me, instead of being told, and we always do 3 areas or whatever. And like I say, I love Harley Med. I still love them.
Yeah, it's not them.
But it really just made me want to do it, to give it my own flavour.
Yeah.
And I set up a magazine, actually.
Oh, I didn't know this.
Yeah, I set up a magazine. We had a big launch in London. We did it with My Face, My Body with Stephen Handysides.
Yeah.
And Living TV came. It was incredible.
Okay, you're just like a superstar. So what was this magazine called?
It was designed for transparency, to debunk and demystify myths. For the consumer. There was never a magazine. Not anymore.
Yeah, it must have been expensive to run.
It was expensive to run. Print was just about on its way out.
Yeah.
So, the concept was there, the idea was there, and we got, just about every brand wanting to be a part of it. It was the first magazine written by medical practitioners for the consumer. And all the others were not. They weren't edited by, the truth wasn't being told.
Yes.
And I know you're all about that.
Oh yeah, I lay it bare.
You do, and I love that.
Yeah, I think it's important. You and I connected over dinner, didn't we? And we had such good chats, and I knew immediately, I'm like, you got to come on my podcast. I remember when I first moved to Liverpool, this was after I had started my aesthetics, this is in 2016, London, I had come from London, and London, I was in an area where my mum had set up a practice, Harrow on the Hill, and patients wanted very elegant, subtle aesthetic treatments. They definitely were not about they didn't want everyone to know. It had to be hey, maybe it's her, maybe it's Maybelline. You know, they
Absolutely.
get really subtle.
Yeah.
And then I moved to Liverpool, and it was, and I love Liverpool to bits.
Yeah.
Like I literally cannot imagine my life anywhere but Liverpool now. But it was a very different vibe. And patients wanted the bigger the better. You know, and I talk about the lips that used to walk in before the rest of the face. It was a real thing.
Absolutely.
Now there's a shift away from that. But I remember I was working for a practice at the time who used to say to me, just do what the patient wants. And I would say, no, I can't put filler in that lip. There is no space. It is not a good look. I'm doing the patient a disservice. I cannot. So instead, I would sit them down, take photos from all angles, and explain to them why that wasn't a good thing. And no one had ever said no to them before. You know, they used to say to me, well, if you say no, I'll go to skin clinic. And I would say, that's absolutely fine. But it's my reputation on your face. And also, you know, as a medical professional, I have taken an oath to first do no harm.
Absolutely.
And if I'm filling to the point of literally combustion, then I'm doing harm.
Absolutely.
And I remember saying to my husband at the time, I'm not going to succeed in Liverpool because I'm not the look that they want. But actually, your vibe attracts your tribe. And over time, I developed this niche of natural looking aesthetics, and that's what patients came for. So for me, it's always been centered around holistic health, wellness, and natural looking treatments that help our patients feel empowered, but also not looking at the face as features. You know, like I do a lot of noses, non-surgical rhinoplasty, but when patients come, so much of the time, it's not that they feel like they have a big nose, but actually they might have an underdeveloped chin. They don't assess their face,
of course,
in all angles. That's our duty.
Absolutely.
And I see the same thing now. Patients will come, they've had loads of filler, but nobody's ever addressed their skin. So when I'm assessing the face, I say to my patients, listen, we're looking at 5 things because your face is not just volume loss or a nose or, you know, you're not walking, talking pair of lips.
Absolutely.
Your face is 5 layers: skin, superficial fat, muscle, more fat, bone. So let's address every single layer.
100%.
And always, there's a great book by Alice Hart Davis called Start With Skincare. And I really genuinely couldn't agree more. If the canvas is not in optimal health, nothing else you're going to do will follow.
Absolutely.
And chemical peels or skin peels, I think, have had a little bit of a bad name because of Sex and the City. When, was it Samantha had a skin peel look like a burns victim?
Absolutely.
And people still have that in their minds, but actually that is not what a skin peel is. Skin peels are, for those who are just kind of listening and learning, skin peels are a chemical exfoliation of the upper layer of the skin, and it can be various depths. We call it desquamation. So we can peel the upper layer of the skin called the stratum corneum. So you can have a no downtime peel. So there are peels where I call it a no peel peel. You'll never know, people won't tell, but we're just giving you a glow, radiance, helping with superficial texture. So that's a no peel peel. One of my favorite no peel peels are the Obagi Blue Peel Radiance, for example. It's a great one to just enhance the glow to the skin. And then there are times where we need to use a deeper peel. Or medium depth peel that will help with deeper pigmentation. Solar keratosis. Which are little pigmented areas. And for that, we might choose a TCA peel, trichloroacetic acid. And then there are deep peels, Samantha, Sex and the City type peels, which hit the deeper layer of the dermis, like the upper reticular dermis.
That's it,
and the skin, people think about the skin as just like one layer. No, the skin is the epidermis, and even the epidermis has 7 layers, and then you have the dermis.
This is
the upper papillary dermis, lower reticular dermis. And which peel we choose depends on the desired outcome, and also patient preference in terms of downtime. Because some patients come in, they say, you know what, I want the best possible result, give me what you have. And some patients say, I want really good results, but I don't want anyone to know, I can't afford time off work. I don't want to have visible peeling. And so in our clinic, we stock over 20 different peels. I use the right peel for the patient.
That's it.
And traditionally, when we are talking about peeling the skin and applying a chemical, what's important to understand is that is a controlled injury.
Absolutely.
And when you're doing it's a controlled injury, right? So it is creating a controlled wound, so to speak. But there's a reason why we do it. And we do that with microneedling. We do that with biostimulators. So when we're doing that, we need to understand that not all skin types will respond in the same way.
Absolutely.
And we have to treat each skin type with respect and with understanding. And again, traditionally, that means patients of skin of color, like me, like you, we would have to really approach with caution when we're talking about particularly medium depth or deeper peels. And there are certain ingredients, we're going to talk about this, where actually I'd be really cautious of applying it on patients with skin of color. And we would definitely do a period of what we call a skin prep. So prior to applying a peel, we give them products that will help to reduce the risk of any downtime, side effects, or response, like in particular post-inflammatory hyperpigmentation, right?
Certain peels are like poking a stick.
Yes, exactly. And skin of color also, one cut, one burn, we pigment.
Yeah.
So it's something that we have to understand. If we're going to be putting a chemical peel on a patient who's skin of color, how are we going to be controlling the potential risk of post-inflammatory hyperpigmentation?
Absolutely.
So certainly in the past, when I was doing patients with skin of color with deeper peels, like a TCA peel, then I would be prepping their skin. What I mean by that is prescribing hydroquinone, which is prescription-only medication. So no matter where you're listening from in the world, please do not buy it over the counter.
Absolutely.
Please do it under the supervision of a doctor, because there are permanent risks.
Yeah.
And retinoid, tretinoin.
Yeah.
So it's our gold standard prep. Then the perfect peel came and literally disrupted the industry.
It did.
So I want to hear about that. What was your journey into that? So obviously you had this why behind.
Yeah, for sure. Well, the thing is, this product was something that dumbfounded me a bit.
Yeah.
I cut my teeth on, I had practitioners saying to me at the Harley Medical Group again, saying, you do you, and we'll see what happens.
Yeah. Good luck.
to my white counterparts. Yeah. And I was like, okay, well, what does that mean for me? So I got a really fast education from being there really, and trying it on myself and pigmenting and seeing how I could recover. What does that mean? What does that look like for me? Why me?
So you had a skin peel prior to...
The problem with the industry or with the word skin peel is so many people say, I've had a good chemical peel. That is the encompassing word for chemical peels. And it shouldn't be because there are so many different denominations like you've just explained. So when we say, I love a good chemical peel, that's so generic for me. Yeah. And I find it very difficult to kind of answer in an affirmative way because there are so many different types.
Yes.
So it's hard. And when I hear people talk about just having a chemical peel, I'm like, okay, well, now I'm getting confused because there are so many different skin colors, there's so many different skin types, there's so many different chemical peels. And like you've said about hitting the different layers. So for me, it was a really deep understanding of this perfect peel claimed to, the perfect derma peel that's in the US that we brought over, trademarked, and now own the brand, claimed to offer a chemical peel, a medium depth chemical peel that contained phenol. A bit of a scary word for most practitioners, or a scary concept for all skin types, as well as TCA, as well as retinoic acid. The amazing glutathione is in there, which I know we're going to talk about as well. Yeah. We must. Can't leave here without it.
I know. Because that's a USP, right? Like that's something that makes a big difference.
This is a game changer in terms of skin products.
And I think that's the crux of what you just said about also the fact that some people are talking about chemical peels and you're like, yeah, but which peel?
Yes.
Because not all peels are made equal. And that's really important to understand. And sometimes I know when I did my peel live the other day on my Skincare Sunday, there was a concern is are patients going to try and buy this online and do it to themselves? Because actually, done wrong or in untrained hands, you can actually cause a burn.
Absolutely.
So it is not something to play with at home.
100%.
And you will find all kinds of crazy acids out there that can permanently disfigure and burn. So do not try at home. These are professional peels that have to be done in the hands of a trained medical professional. We are not messing around here. And also, it's very important to understand this is an unregulated industry.
Yeah.
And peels are unregulated, aren't they?
Yeah, they're unregulated. You can find them anywhere. You can find any product anywhere online. Fillers, we know. We've seen it being done.
I mean, now there's 400 different fillers in the market in the United Kingdom. I think there's only something like 15 in the USA because the USA have good regulation and protect the public. And unfortunately, the United Kingdom don't. And we've heard of just recently on Save Face and on ITV News, there was patients having... bum filler, 500 mils of bum filler by non-medical professionals, not even professional, non-medical people. And also there are reports of people having bathroom silicone injected into their bums. So when we are talking unregulated, we're talking danger zone. There is no messing around here. I cannot sugarcoat.
This is it. We started out, I remember starting out with dermal fillers with a company called QMed that had Restylane early on. Yeah. And I was doing Zyplast, so collagen filling injections, which required a 28-day patch test before you injected it. So, it wasn't just come in and have a treatment. It was really thought about. We had to patch test patients, to see if you were suitable for collagen.
How did we go go so wrong then?
This is the thing. What happened? You know, actually there was more precaution in it. Yeah. But, you know, I think because anybody
But I think that's because it was led by medics, right? And I think the more you know, the more you're aware of what you don't know.
Absolutely.
And the more cautious you are. Whereas some people, you know, think that by absorption of information from YouTube, you're a doctor and you can do anything. And that is the danger. It's this unconscious ignorance that actually puts patients at risk.
Absolutely, 100%. You know, I think so many people now, unfortunately, because social media has blown up the way it has, it's great. It's got a really amazing side, but the darker side of it, these are the things that we need to educate our patients on. And, you know, you're doing it, I'm doing it constantly. You know, my patients quite often say to me, I can't believe you said no to me.
Yeah, I know.
And they'll come back because of that.
Exactly. That's the thing, is they're not used to people that have the ethics and the integrity of turning them away when they don't need something.
Absolutely.
And actually, you know, I remember this in Liverpool when I first moved, and my boss took me to one side and she said, stop saying no to patients. And that's why I really thought, oh, I'm not going to survive here. And I had to leave that clinic in the end. And that's when I started my own, because I thought I had a real vision of what I wanted.
Absolutely.
And it was not a one in, one out kind of clinic. It was giving my patients time and being ethical and not being afraid to say no, having the integrity and the ethics to advise them for or against any procedures that was necessary or not necessary. And actually, that in itself is a business builder, because that patient who's never heard no before would go and tell their mom, their auntie, their friends, and their friends would be relieved that finally someone said no. And so their mom would come and their auntie would come. And so my message to anyone listening here is actually find a practitioner that will say no to you when you don't need something and will safeguard you.
Absolutely. It's not always in the patient's hands.
No.
When they feel that they're paying for a treatment, there can be, this transaction can empower the patient. And it's up to the practitioner to be able to educate correctly, properly, and actually...
Ethically, ultimately. It's like when I'm teaching... I run training courses. When I'm teaching, the second slide of the day has a picture of Michael Jackson and Donatella Versace. And I say to them, the number one thing I want you to learn is the importance and the power of the word no. Because we know that when we start treating patients with filler, sometimes they get what we call aesthetic blindness or perception drift. They forget what they look like. They start to get used to it. They think that they need more and that more is more.
They get used to their new normal.
Exactly.
Very quickly.
Yeah. So you need a practitioner. You know, to me, when I'm looking at Donatella Versace or Michael Jackson, I don't blame them. I blame the practitioner.
Absolutely.
So it doesn't matter how much money you're waving. It's irrelevant. No means no if it's not right for you. If it's not in your best interest, it's a no.
That's the mantra that I live by. It really is. Because I do not want to actually put my name to somebody's face that looks like that.
Exactly. It's your reputation, right?
100%.
So then chemical peels.
I had practitioners, colleagues saying to me, well, you do you, and we'll see what happens. And I have patients saying to me, I've had a good peel, and it's about really demystifying what that means. What peel do you mean? What should we do? You know, all of that sort of stuff. So the perfect peel made complete sense to me. Looking at the protocol with this, apply it to anybody's skin. Okay, I was still trying to get my head around the fact that I was growing up. I'd cut my teeth on, we need to prep. Of course we do.
Yes.
But you have to understand the reasons why you're prepping. So we were prepping because we were using single-minded acids.
Yes. Not combination.
So
right.
at very low percentages, and there are lots of practitioners that still practice this way and have done for years. I mean, the Jesner's peel. The basic Jesner's peel is a really good example of when Dr. Max Jesner said, hang on, I'm not doing these strong peels anymore. And studies that have shown more recently that TCA in low percentages actually favour TCA at between 5 and 15, 12 to 15%. So we used to use TCA starting at like 12 and titrate it up. And then we were bringing patients in to do superficial peels. So we'd manage that layer. And then we would do the TCA to manage that layer. We actually now, patients are coming in with a combination of different issues. And that's another thing that really drew me to you because of your facial harmonization. I love that concept. I've been living by that concept for years. That's the only way I know how to treat.
Exactly.
All right. And I find it quite strange. So that I look holistically at the patient and I can't do it any other way.
Exactly.
We do it within budget, of course. We do it within parameters for them. But I think it's the only way that you can assess a face.
I agree entirely.
From all of the layers.
I agree entirely.
And that's why the perfect peel made sense to me. Because it's born out of a similar ethos. Having lots and lots of acids at low percentages, which reduces the risk improves the safety, gives a more beneficial result for the patient. So we're low and slow. We're doing what we've always done.
So you heard about so in America, is it regulated?
It's still, I mean, each state has got its own regulation.
Okay.
State to state, one state can approve TCA, another state can unapprove phenol. So it's very difficult actually to launch anything in the US. You need to make sure that each state has its own sales reps and plans and things. So it's not easy. So it's regulated, but it's still under a heavy hand.
There's no standard.
Yeah.
So you heard about this how long ago?
So a friend of mine from the US, because we were doing all sorts before then. I was trying my hand at various different things, as you can imagine. Had clinics and all sorts of different things. And from the magazine, actually, a friend of mine had said to me, "Oh my God, you don't have the perfect pill? What?" So I said, "No, actually." And we
in your British accent,
in my British accent, all based from Pacific. We brought the pill over and I was applying it everywhere. I think my husband found me just upstairs in the bathroom applying it everywhere, going, "You can do it without any prep." He was like, "Are you sure?"
Were you afraid at the time?
I put my faith in it because I'd read the ingredients and glutathione was the one that stood out to me. Yeah. Because of its ability. It was still relatively unknown. More studies need to be done topically, but the studies that have been done propel this product into a new era. And I saw something that you talked about the other day about the Cheeto and time and all that. I love that. Yeah. I'm so down for like NAD and NMN, all of these precursors to our DNA. Yeah. And glutathione works in a very similar way. Glutathione actually is probably more important than really working hard at getting NMN and NAD supplements. If you can sort your glutathione out, if you can manage to understand your glutathione level, because it depletes. And at the point it depletes, we see aging. Yes.
I mean, people are taking glutathione supplements now and also IVs. But let's talk about the ingredients inside the perfect peel. So sorry, how many years ago was this when you got...
it was about 8 years ago now.
8 years ago. So you heard about it from America.
Yeah.
You brought it to the UK.
Yeah.
You changed the branding from, was it Perfect Derma?
Perfect Derma Peel to Perfect Peel.
Perfect. I love the name, by the way.
Thank you.
and then you started to market it and use it, I guess, on your patients primarily.
Yeah. Gave it to some friends of mine that were now big today. So Dr. David Jack, Fab Akizi, Isho, trained all of them.
Okay, amazing. And so the real uniqueness of this specific peel, and I've used high TCA peels. TCA is trichloroacetic acid, and that is what we call medium depth peel, which means it penetrates beyond the epidermis. We're going into the dermal layer now, and patients are going to have a proper peel. They're going to shed physically, visibly, and they have downtime, usually 5 to 7 days of downtime. That doesn't mean don't go to work. I mean, I have a peel and I had my podcast while I was peeling. I teach, I speak, I'm back seeing my patients. It does not stop me. But I think some patients would feel conscious maybe of physical, visible peeling.
Absolutely.
So they need to be aware of that.
Yep.
But it's great because it's very results driven.
Yeah.
And then phenol, traditionally, phenol is an ingredient that has been used for deeper. We're talking reticular dermis.
Exactly, upper reticular.
And actually, when we're talking about reticular dermis, what that means is, for our patients, is that is a deeper layer in the dermis. Yeah. And that is traditionally phenomenal for lines, wrinkles, folds, sun damage, because we're dealing with the deeper layer of the fibroblast, where all the folds and lines and wrinkles are, and where we're trying to stimulate new collagen.
Correct. It's a driver. Phenol's a driver.
It's a driver. Yeah. But at the same time, it's definitely not something to try at home. It's definitely something that needs to be done in a doctor's hands, and it has high risks. And you peel significantly, phenomenal results at the end of it, but there's also risk of cardiac arrhythmia. So people are afraid of phenol. And we know that, you were talking about how you actually got the perfect peel insured, because traditionally in the UK, nobody wanted to insure phenol peels, right?
Absolutely. It was off insurance policies because of this risk, this worry. Yeah. And there were strong phenol peels. So there was a peel that was well known, the lip and eye phenol peel. And I remember it being excluded from most indemnity policies. And I was really confused by this. I was thinking, okay, well, I know it's strong, okay, it can't be in the hands of, you have to be this level of trained practitioner. Yeah. So I approached the Lloyd's of London underwriters, went above the insurers' heads and said there are far sharper instruments instruments in my patients' in my practitioners' toolkits
Yeah.
than the perfect peel.
Yeah.
Talk to me, like, what can we do?
Yeah.
And they agreed. So we were the first peel
That had phenol.
that had phenol in it at that percentage.
And it's okay in skin of color, and it doesn't need prep. You got to explain this basic science. How come?
So by using low percentage acids, combined low percentage acids. So when you're using single-minded TCA, single-minded phenol, so individual acids, you are not able to control the way it behaves in the skin. And you would bring them back in to try to, or you would be prepping to control that. Okay. So you would, of course, by applying these acids, the skin would naturally want to fight back.
Yeah.
You get a hyperstimulation, post-inflammatory pigmentation risk. You get this hyper stimulation of the melanocyte.
Yeah.
And that is absolutely true when you're using a single-minded acid. So we have to prep there. Now, there is this, I'm not saying this is a complete no prep peel, because skins that are at risk or damaged, so skins that fall under what I would call their not normal skins, so hyperpigmentation, photorejuvenation, acne skins will need prep. Again, we know acne skins can purge. They tend to purge at around week 3 when you're peeling because of the way that the keratinocyte moves up to the surface of the skin. You can see this acne purge.
But to be fair, acne-prone skin can purge, which means have a reaction of an acute outbreak of acne.
That's right.
With any controlled injury.
With any controlled injury, that's right.
Whether it's microneedling, whether it's lasers, when you are stimulating the skin, you can end up having a bit of an acne purge. So I think, how I manage that is with my acne-prone patients is we have a chat about it. And sometimes in some patients, we put them on some antibiotics to manage that. So I don't know if you do the same.
Same.
You do the same.
Yeah.
Okay.
Try to just control it because we'll let them know, it's sometimes really daunting.
Yeah.
Acne patients are patients that have normally thrown everything but the kitchen sink at their skin.
Listen, I'm that person. I'm acne prone. I had a laser, I think a BBL or a Moxie laser, and I looked great for 1 week, and then week 3 I had an acne breakout, and it's so distressing and soul destroying because you're like, oh, you look good for a bit, and then you've got this acne to deal with. So I definitely think prepping our patients and managing an acne breakout in patients who are acne prone makes a lot of sense.
It's massive, isn't it? You have to. And again, acne patients have got a different mindset.
Yes, I like that. Yeah, you're right. Yeah.
They have a different mindset. They're very educated.
Oh yeah, they know.
Because you've done everything to your skin. I'm one. I'm the acne prone patient. So
I do not believe you.
I swear I've just got it under control. But the thing is, it's about recovery.
Yeah.
If you get one spot, that's all right.
Yeah.
And it's managing that.
Yeah. It's also knowing how to manage. Exactly. It's knowing how to take that down quite quickly as well.
Definitely. And making that okay though.
Yeah.
You're never not going to get a spot.
Yeah.
You're going to get a spot.
Yeah.
Same with pigmentation.
Yeah.
You're never going to get rid of it. And one of the things that we talk about with training is managing it.
Yeah.
If you stop using any of these pigment inhibitors, it's going to come right back.
So I'm so glad you said that, because I hear a lot of people, I think especially non-medical staff, who don't really understand and use that basic pathology of things like melasma. Melasma is a chronic skin condition, it's chronic pigmentation that you cannot get rid of completely nor control completely, and may flare up at some points. But it's about understanding that this is a chronic condition and we have to manage it in the same way we would manage diabetes.
Absolutely.
In the same way we would manage any chronic condition.
Absolutely.
And so they use that in a way to dismiss specific treatments like tretinoin or hydroquinone, which is nonsense actually. Once you get to where you want to go, it's about proper maintenance. And I say to my patients, listen, so they say to me sometimes, oh, but if I stop it, then it will come back. And I say, well, sure, but if you stop brushing your teeth or stop flossing, then your plaque would build back up and you'll get decay. So if you want good teeth, you have to brush twice a day. And you need to see your hygienist twice a year. If you want good skin, you have to be consistent with your skincare. It is really quite simple.
Well, the thing is, we know that, but there's a real there's a real sort of weird oxymoron, isn't there, with medical practitioners treating patients. We never treat. We're managing them. Using that word treat is a word that is fixed in patients' minds because historically they're speaking to a doctor or a nurse or a medic, any medic that they have been to before to treat a problem.
Almost like completely curative.
Fix it.
Yeah.
So this shift that you have to do when you move into a business, which makes it feel more transactional and less like, okay, well, I'm not doing that. I'm still not very good at taking the money. You go over
Me too.
It's so hard.
I'm not good at that. And I I don't like doing it, so I have my assistants have a chat. So I do the medicine. I'm like, okay, this is what I believe you need, and like the budget wise, we'll work within our patient's budget. But I don't ever want to be. I'm not a saleswoman. That's not me. And if that's not my forte, then I just. Of course, these things cost naturally.
That's it. But that's where the tricky thing comes in for a lot of practitioners, because they want to fix it. Yeah. They want to treat it. Yeah. That's how we've been brought up within our medical fields. Yeah. It's to treat a problem, we fix it, it goes away, and then people pay for a treatment and they go, "Hang on, I want it to go away."
Yes.
You go, okay, hang on a minute. And peels are a really good example of that. Yeah. They're not as tangible. Yeah. As doing a dermal filler where you are slimming the face, you're contouring the face, you're making something, making a nose look smaller, even though you're adding something. And it's a new concept, isn't it? So I think that having the patient really understand that there is this kind of, it's going to take time. Yeah. We need to manage your expectation. Yeah. Where chemical peels are concerned, some of it's a feeling. Yes, you can see it. The perfect peel obviously comes off in those layers. It comes off in epidermal sheets, like you've said, between days 3 and days 5. It's fairly manageable, but it's got phenol in it. So it's a business peel. There are days where actually it's quite uncomfortable.
When you say it's a business peel, what do you mean?
So I mean, it's a serious peel, really.
It's a serious peel. Okay, fine. So we're talking, you're going to visibly shed here.
Yes, I think the thing is, this combination of ingredients has, and it's quite a sexy looking peel. Yeah. So when you see the shedding, people go, "Oh my God, that's a peel. I love it. I want a peel." They have
to be honest, I love peeling. I mean, I do a medium depth peel once a year minimum, twice a year if I can. It does make a difference. I think it is results driven. But you have to be realistic about all treatments. First and foremost, it is not a substitute to consistent skincare. It is an add-on, it's an adjunct. And we use multimodality treatments for the face is multiple layers, right? So
you have to,
I always say to my patients, every layer of the face needs to be in the same decade.
Yeah.
Right? There's no point having these big cheeks and your skin is sagging or the muscles are sagging. So we need to treat every single layer if you want natural looking results. It is exactly the same with skincare, skin enhancement, skin rejuvenation, skin resurfacing. First of all, one size doesn't fit all.
Absolutely.
One tool is not going to fix all your problems. Yeah. And you do need consistent everyday care. In the same way, you would come to a dentist, have your teeth cleaned, but you need to use the right products at home. You need to brush your teeth every day at home. Yeah, so the right home care is vital. It is non-negotiable.
100%.
But as an adjunct, it is remarkable. And for me, I definitely, I had a, how long ago was it now? My skin peel, my perfect peel, I think it was about 3-4 weeks ago. Yeah. And I definitely feel smoother. I think the inflammation is reduced. Pigmentation, post-inflammatory pigmentation. I'm very pigment prone because of my skin color. Yeah. Soon as I get an acne spot or a blemish, I end up with a little blemish that lasts for months and months and months otherwise. Or a red mark that lasts for months and months and months. And there are some things that will just exfoliate and expedite the shedding of the skin and the healing of the skin. And for me, skin peels are an amazing tool in the toolkit to get my patient's skin to where they want to go. And wintertime is such an amazing time to do all these things, actually.
It is. What I think lots of patients struggle with this, like you saying, this multimodality thing. Yeah. It takes about 28 days to 6 weeks for you to really see the new skin, because what you do now, you're not going to see. Yes. Obviously, the keratinocyte that you see daily, we're at the peel penetrate. That's why we put layers on. Yeah. It penetrates down. Yeah. We're affecting the new keratinocytes that you can't yet see. So one of the things that you have to really be honest with it, with your patients, or certainly I feel like I'm constantly saying this, is that, what you do now, no matter what you do, products, peels, whatever we're doing,
you won't see it now.
You will not see it now. Yeah. And one of the things that we say is you'll see results in a week. Now, I have a bit of a problem with this.
I have a problem with this too.
Because it's very, very...
it's expectation management.
Expectation management. And I find it difficult to be... Whilst, yes, it's using the words, you'll see improvement.
You know what you'll see? In a week's time, your skin will naturally look a little bit more radiant and feel smoother because the dead skin cells have shed, so to speak, right? The stratum corneum is gone. So you've revealed fresher looking skin. Fine. But
the results in a week?
Skin, I think it's important whenever I'm talking about aesthetic medicine, healthcare, holistic health, I always say, let's look at the source of the problem. Yeah. And let's treat the problem at the source. Not just stick a plaster on it, 100%. Not treat the symptom. Yeah. And it's when we're talking about skin peel or skin rejuvenation or skincare, it's important to understand the biology and the pathology of skin cycles.
Absolutely.
From the moment a skin cell is born to the moment it moves up the layers of the skin and reaches the upper layer of the skin, the stratum corneum. We're talking 6 weeks, right?
Absolutely.
So you need to go through a full skin cycle.
Absolutely.
In order for those new skin cells that you've just stimulated to reach the upper surface.
Correct.
So
and they're shedding at different times.
Yeah.
That's why historically you will hear lots and lots of brands say, give it 3 months.
Oh, yeah.
You know, with skin products.
Yes.
It's not always true, actually.
Yeah.
Because you know you can catch keratinocytes. Yeah. So when people do say they see results in a few days, a few weeks, they might be right.
Yeah.
Because they will see some degree of improvement in the keratinocytes that have been got.
Yeah.
That were on the way up.
Yeah.
So you do, it's just not one size fits all, like you say.
Yeah.
You know, so, and that's some of the products that we've just created, the glucoceutical side of things, we're looking at the ability to manage these 3 pillars in skin. Pigmentation, red, brown, secretions, oils, lipids, and then texture. We all go through those. And lots of patients, quite often, we have been programmed now to believe we're either, and you probably remember this, oily, dry, or combination.
Correct.
That was it?
Yeah.
There's 3. You can't be anything outside of that.
Yes, you're right.
And, you know, we used to go into department stores and go, I'm oily, I'm dry.
Yes.
You know, and that was
for
it.
everything, skincare, makeup. Yeah, you're absolutely right.
And as we age, our skin changes. So we have to be truthful to our skin. We don't have to be stuck in the way it was. We know that extrinsic factors can alter our intrinsic factors and vice versa. You know, we're led by both external, internal factors.
Yes.
And we have to be honest and we have to be real when we're coming to skin. And it's okay to change it a bit.
Yeah.
You know, my mum still probably wears the same things that she's worn for years because that's the way. There's no other education. So, you know.
My mum still doesn't believe in SPF. So like, it's a real battle of the worlds, honestly. But, you know, some people are stuck in their ways. But with education, we know this now, right? And we know that also as you go through the perimenopause, menopause, your skin does change.
Absolutely.
Actually, when you have a reduction in estrogen, you're going to get more dry skin. Yeah. You might notice that your sebaceous glands are not producing as much. So you're less, when we talk about dry, you can be dry, dehydrated. They are 2 different things.
Absolutely.
And more sensitive. The barrier function might be more impaired. So we have to tweak our skincare.
Correct.
It's very important to understand that it's not necessarily fixed. But I want to go back to the peel and I want to talk about the different ingredients. So you've talked about there's a low percentage of phenol, and the reason for the phenol being there is what?
So what phenol does is add that extra real kick to the deeper layers of collagen. So we want to see some stimulation. So that's why one of the reasons why we made this medical only was because we wanted something that was a little more aggressive.
Yeah.
So we needed the phenol alongside the TCA, the retinoic acid, vitamin C, glutathione, salicylic acid. I mean, it is a disruptive peel. Loads of brands historically have had lots and lots of different peels to do lots of different things, but patients are impatient. So they want results now. And also, we also want to improve our practice and say, we do know you've got pores and you've got fine lines and you've got pigment. All of these things, this has made so much sense to me. Can coexist. The skin is its own microbiome. You know, the skin is its own house. So, you know, it has to manage these things all of the time.
Yeah.
And of course, one of the things that phenol does is also future-proof the skin in the same way that vitamin C does.
I love that. Okay. So in there, so you've got your phenol for that deeper layer, and of course you've got boosters, and the boosters can actually take it to a deeper layer.
Exactly.
Which I think is going to be my next thing.
Oh, you'll love that.
Oh, I cannot wait. Maybe I'll come to you and you can.
Yeah, definitely.
Okay, we can film that on a skincare Sunday.
Perfect.
So we'll do phenol.
Yeah.
Phenol takes it deeper.
Yeah.
And the boosters will take it even deeper if you want more results driven. More of a results-driven outcome. And of course, as you said, our patients often present with multiple concerns: pores, texture, acne scarring, pigmentation, oiliness, whatever, fine lines and wrinkles. So they don't just come with one thing.
Correct.
So actually, if you can use one treatment or one peel that will address all of these things, and these are the indications of the perfect peel, or all of these things, then you're doing your patients a huge favor.
Massively.
Rather than being, like I say, I don't do feature-driven results. I do holistic. So you're being holistic about the skin.
This is it.
The next ingredient in there, TCA.
Yep.
Tell me about TCA.
So TCA, again, it's one of my favorites.
Oh, I love TCA.
You love TCA. Yeah. It's brilliant. It's a Swiss Army knife.
Yeah.
Same as azelaic acid.
Yeah.
That's not in this one, but it's a Swiss Army. It does such a lot.
Yeah.
It's amazing. Well, when it's controlled, Years ago, it was not controlled. We didn't control it. So what that meant was it was fraught with complications, and especially unable to be used on darker skins. So it was like, you can't have TCA. So it completely discounted fits 4, 5, and 6. So it was only really for 1, 2, and 3. Yeah. So one thing I love about Phenol at low percentages is it's able to stimulate the fibroblast, also able to work
and the fibroblasts make collagen.
Fibroblast makes collagen, work on the melanocyte,
which make pigment.
Exactly, so we can inhibit the pigment. Yeah. And of course, with its penetration through the layers, it smooths the skin. So it's a real like all-rounder. And that's why historically it's been used. And that's why it's still really well loved today, because it can do so much.
Okay, and then the next ingredient?
So we've got salicylic acid.
Yeah. That's a beta hydroxy acid.
Amazing.
Yeah. So that's lipophilic. It loves oil. It's going to break up, decongest the skin, break up oils, help patients who are acne prone.
Great for congestion. Yeah, it's fantastic. And in combination, actually, with the...
And anti-inflammatory.
Anti-inflammatory, it's incredible. Again, it's another one of these ingredients that is so well known, and that's why it's used in so many topical formations today, formulations, because of its ability to be able to provide reasonably instant, we say that we don't like that word, but within a few weeks or so, you can start to see dissolving of that real follicular impaction. So for acne prone skins, it's great because they see an improvement in salicylic acid, in inflammation very quickly.
Yeah, a lot of people don't know, but salicylic acid actually comes from aspirin. So it is
that's right.
Anti-inflammatory.
Anti-inflammatory, yeah.
And then you've got the antioxidant, the glutathione.
The glutathione and vitamin C. Now, they work really well hand in hand. They boost one another, as does vitamin E also. And there's a little bit of that in it. But glutathione is our body's master antioxidant. And it starts to deplete, as we know, I don't think I've got any left, around age 40-ish. Yeah. But it is so, because we make it, our body understands it, it recognises it. It is a bit like Pac-Man, where we know how to put vitamin C on the surface of our skin, and it starts to improve and get rid of all the oxidization in our cells. That's why it's antioxidant. So all the nasties, all the peroxides, everything that runs around that are going to try to depower ourselves and damage ourselves, it engulfs those really quickly. And I love that whole engulfing. So it is like the Pac-Man. Vitamin C is amazing, you apply it topically, but we don't make it. We know glutathione works. We haven't seen it as much in the more Western world because of its ability to lighten.
Yes.
So one of its side hustles is it lightens the skin as well as being an amazing antioxidant.
It's huge in the Middle East.
It's huge, isn't it?
Yeah.
I think that's probably still steeped in some cultural...
It is. It is like, it's the fair and lovely. That's what they're after.
This is it.
Yeah.
We all want it. That's what I was after.
And so, exactly.
All those years ago.
so that combination means that you've got really evidence-based, scientifically driven, results-driven ingredients that work in combination with each other to treat a wide range of skin concerns.
Correct.
And because they're not in high doses or single, they have a much lower risk of causing PIH in patients who are skin of colour.
We still see the risk when you're doing a superficial acid because, of course, it's a self-limiting peel.
Yes.
So it stays on the patient's skin. Your body is its own stimulus to stop it, which makes it even safer. We still see the risk of things like pooling in the dermis when we're using superficial acids like alpha hydroxy acids.
Oh, yes.
They're time-based.
Totally. You need to get them off the skin in a certain number of, they're not self-neutralizing. We have to take them off.
The thing is, and they can be abused because people think, I'm just going to keep it on for a bit longer.
Yeah.
And then it burns.
And they continue to penetrate. People don't understand that actually. It will continue to penetrate through the layers of the skin and burn.
Yeah, that's right.
And burning means potential risk of disfiguration. So it's not to be taken lightly.
100%. And that's why I love this. It actually makes sense for practitioners. It makes sense for patients. It does all of these things. And like I say, these 3 pillars, we have to respect these 3 pillars because they're happening all of the time. If you've not seen pigmentation yet, you'll see it.
So are there any contraindications for patients who can't have it?
Yeah, absolutely. So pregnant women, breastfeeding women, of course, people with an allergy to aspirin, patients that potentially have got cold sores and are prone to hepatic infection. Quite often with aspirin, though, you don't always see a true allergy. You tend to see gastric irritation, don't you? But if you do have a full-blown allergy, of course, we've talked about aspirin. Also, I think realistic patients, you've got to get people's real understanding of what's going to happen.
Yeah. I think that's with all aesthetic treatments.
For sure.
Really, it's expectation management, ensuring that the patient understands the outcome that they're going to get.
Yeah.
I'm very blunt with my patients. Say, you will not, sometimes patients are going to go, I want this. I'm like, oh, okay then. We're not going to get that from this treatment because that's a facelift. So we're going to get an improvement in skin condition. But
how many people do that?
All the time.
I just want that.
Yeah, all the time. I had one yesterday. She was like, I just want this. And I'm like, I would too, but maybe that's not going to be possible with today's treatment. It's about managing expectations. Surgery is fantastic for the patients who want to go under the knife and who can afford $50,000 for a facelift. That's right. Not everybody can, but it's very important that we manage expectations.
Yeah.
So, and then are you doing peels regularly? Is that kind of part of your toolkits, or is it a one-off once a year kind of thing?
No, I would say with all skins become sluggish.
Yeah.
It's an organ.
Yeah.
We need to continually assist that turnover. So by doing 2 or 3 of these a year, you said already, that's what I do. I do 2 or 3 peels a year and then maintain it in between.
Yeah.
Now, the thing is, desquamation, peeling has become a bit of a word that's a bit like, we can't possibly peel it all the time. Yeah. You absolutely can.
Yeah.
Your skin, that's how your skin knows how to function. Because it's doing it itself.
Yeah.
The keratinocyte turnover, like you say, 6 weeks, we're constantly having shedding happening. So by accelerating that, twice or 3 times a year and in between, it's really beneficial. As long as it's not abused and overused and not in high percentages, then you can expect to be completely worn away and sandpapered down, but we're not wanting that.
But that's not what we're wanting. Really, it's about stimulation. I think that's something that people misunderstand about peels, and they go, our skin is just designed to fall off on its own anyway. Well, sure, your skin is designed to shed, but if you're not appropriately, I use an acid every day, actually.
Yeah.
I use azelaic acid every day. And sometimes in the evening, if I'm not using my retinoic acid,
absolutely,
I will use an overnight glycolic. So I am constantly stimulating my skin. And there's something to be said about that. And I think people misunderstand it and they think, again, you're going to be physically shedding. No, you're stimulating and you're essentially breaking up the glue that holds dead skin cells together.
Correct.
So you're revealing more radiant skin. But more than that, we need to understand that as we are aging, our skin cycles go from being 6 weeks to 7 weeks,
absolutely.
8 weeks,
they become
9 weeks.
sluggish,
slow. It's like chugging along, right?
Yeah.
So when we are, especially our older patients, actually.
That's right.
Skin peels or daily gentle exfoliant. I don't like physical abrasive exfoliants.
Same.
I like liquid exfoliants, a chemical peel essentially.
Yeah, same.
Will stimulate and remove the upper layer of the skin and it's almost like a fertilizer. It kickstarts that cellular process. So it's not going to sleep and getting sluggish. You're waking it up and you're getting that skincare cycle to start being a little bit faster again.
Absolutely. It also starts to thicken things like the granular layer.
Yeah.
We can start to see the skin behave and perform better.
Yeah.
So, there's an argument about moisturizing versus hydration.
Yeah.
And the skin becomes very lazy if we don't. So all these ingredients as well allow better penetration of product.
Yeah.
So you find that your skin starts to actually work better and smarter and harder itself because it kicks off things like our natural moisturizing factors.
Exactly.
Stimulates our glycosaminoglycans. It's starting to actually behave that we go, okay, well, I don't maybe need this as much, or hang on, I can do a day without.
Yes.
And that's where we need to get to.
Yeah.
It's okay to do a day if I forget.
Yeah, it's all right.
We're human.
Yeah.
We will forget. So, that's, I when I get my patients to that point where they think they cannot do without that, I'm like, I can do without it for a day.
Yeah.
And they're not, it's not become this blanket of like, if I must, it's okay because they're using the right products.
Yeah.
And that, like you say, that constant nibbling away, that constant just minor stimulation makes for a far better skin health, skin canvas, other products that you do. My patients, when they come back for, ablative treatments, we get a far better result.
Oh yeah, because your skin is conditioned, right?
Absolutely.
It's in good health. And I'll finish off by saying this now, is that when we are doing things like skin peels, they are one tool in the toolkit. And your everyday kind of consistent skincare, it's important because it's actually not just about aesthetics. You are regenerating the cells, and skin peels are one of those modalities. And I'm a big fan of regenerative medicine, big fan.
Yeah.
When we're doing a skin peel, when we are stimulating collagen production and glycosaminoglycans, when we are we're taking that skin cycle from 8 weeks down to 7 weeks, and we're waking it back up again.
That's right.
it's not just that you look good. It's actually very important for the health, right? And your skin is an organ.
Absolutely.
It's not just a barrier, it is a carrier. And, it's important for wound healing. It's important for cellular differentiation. It's
100%.
important for cell signaling. Glycosaminoglycans are there to hydrate the skin.
That's right.
Collagen is not just there for structure. It actually communicates.
Definitely.
Right? It's there. It's a communication tool. And it's there not for structure and integrity alone, but also for wound healing.
This is it. That's why retinoic acid in the peel. We didn't mention that, but that's an incredible.
Yeah.
That's like the beauty secret product, isn't it? That came out and everyone was like, I need to use that.
Yeah. And in the most researched anti-aging ingredient.
That's right.
So it's a huge one. And I think that's really important messaging is going back to the basics. So you and I talk science and you and I think like scientists. So when we're talking about ingredients, I'm like, okay, but why? Yeah. And what does that do?
Yeah.
And we're talking about what does that do on a cellular level?
Absolutely.
What is that doing right down to its core? How is that impacting the function of the skin?
This is it. And this is what it means to me.
Yeah.
And I will talk through this with my patients meticulously. Yeah. So there's no consultation. I don't think they've had a consultation like that unless I've been to you. But we go into
the educational process.
Absolutely.
Yeah. And they're mind blown because people don't talk to them about that.
Like that.
They don't understand. So I love that. And I love that we speak the same language and we have we have the same ethos, really.
Yeah, 100%.
And I think it's so important. This is the whole reason for the podcast, is to educate our patients because I think it's about breaking down myths. It's about empowering them with information.
Absolutely.
Not from TikTok influencers who are talking about lemon bottle on, Russian lips and the next nonsensical thing, because trends and fads will come and go. But what will remain is evidence-based treatments. And also what will remain is right down to the core. What are we doing to the biology of the skin? What are we doing on a biological process?
100%.
So when we are talking about skin peels, your skin might look nice. But actually, for me, that's just one of the great things. For me, it's also the health of the skin.
It is the greatest piece of kit that we have in our toolkit.
I love it. And I love you. Thank you so much for coming on the podcast. I want to finish off with one question. I can't not ask you this. Sure. You are such a powerhouse and a superstar and you're filled with confidence, bringing over this peel from the USA and rebranding it. How do you get that confidence? What would you say to the next generation?
Do you know? I still don't know.
What's your secret sauce?
My secret sauce? Be authentic, be me. It's taken years for me to actually feel confident. I've just stayed in my own lane. I've not really looked left and right. I think it's really important to do that. It's taken me a long time to understand that actually, what I'm doing is for the good of my patient.
Yeah.
And I think if I know my outcomes are good, then I know they will be for everybody else.
So if you could say something to your younger self, what would that be?
Oh my gosh, believe in yourself.
That's it. Yeah. I love that. Thank you so much.
Thank you so much for having me.
I could speak to you for ages. I probably need to have you back on another podcast. Thank you.
Thank you, my darling.